What's up, everybody? Steven Bergrand here, Pro Physique, and today I wanted to talk about injury prevention. Hey everybody, how you liking that Red Robin hat grind? Got my car in the shop today, getting some brake work done, because I didn't feel like doing it myself. All my Pro Physique hats were in the car. So I'm taking it back to them surfing days, waiting tables on the grind with the Red Robin hat. Hope y'all like it. So anyways, a good friend of mine made a video today, and it really just, it sort of got me, and it got me on this topic of injury prevention for a reason. So the good friend is Colin DeWay. If you don't know who he is, I definitely recommend checking him out. He's a great trainer, a great guy, a good power lifter as well. Just all around one of those people that I really like having around. He's super good guy to bounce ideas off of and to talk about things with. And just all in all, someone I really enjoy being around. So Colin was discussing how he has been dealing with a lot of issues in terms of injuries, just like little tweaks here, little tweaks there. If you're familiar with Colin, you know that he actually had to stop lifting for a little while, relearn how to squat because of some medical issues that he had going on, and change his bracing technique as well. And so one thing that I see a lot with powerlifting is injuries. Now, some of this just can't be really mitigated. You know, things happen. Normally an injury happens in a very split second and normally under heavy load. And for powerlifters, that's kind of what we do. We want to lift heavy, right? That's the thing. And so everybody is built differently. Yes, so different moment arms, different lever lengths, you know, how long your torso is, where your muscles insert and originate at. So these things differentiate between individual to individual, of course, but there are some sort of standard guidelines that we can look at for how to be safe. I don't want to be personally one of those power lifters that's always coming back from an injury. I want to stay as safe and as healthy as possible, as long as possible. When powerlifting becomes something to where I can't do it anymore, or the risk is too great, I will stop. I'll go back to bodybuilding style training. I really love powerlifting. I enjoy it quite a bit. However, I think one of the things that people really tend to overlook is the long term. And so one of the things that Colin brought up is that long term. Am I going to be able to be up and about when I'm 80? Am I going to be able to play with my grandkids? Things like this. For a lot of us, we like to live in the moment, and I don't necessarily think that that's a bad thing inherently. It definitely helps you to change the things you're looking at and to focus on things that matter in the here and now. But there definitely are long-term things that matter as well that we want to keep in mind. When we talk about injury prevention, this is helping to protect those long-term investments and goals. There are crazy strong people out there with crazy great genetics and phenomenal training and programming. I just want to be the best me that I can be. I know that it is very typical, especially as a competitor, somebody who does it competitively, to look at other people and compare yourself. But I just want to be better than I was last time. That's really what it should come down to. I'm never probably going to be at a John Hack level. You know, it's just not going to happen. I'm never going to squat what Layne Norton squats. So what's a realistic goal for me is probably short-sighted on their end, you know? Like, it would be shorting them. It's too easy. So when you're talking about injury prevention, I think first and foremost is that your coach understands you as a lifter. That they don't just give you something, that they don't push you too hard, or that they understand your goals in depth. If your goal is to be the best in the world, and that's actually a possibility for you, then yes, it's probably going to be necessary to program you a bit more in depth, to program you harder, to really push it a little bit more. Because those small differences can end up making the difference when it comes to the platform and your total. If you're somebody like me who does it for fun, who does it for just a good way to stay accountable during their off season, then you probably don't need to be as harsh and push as hard on those parameters like volume and intensity, and really pushing for that extra percent or two. For somebody like me, I want to be healthy for the rest of my life. Injury prevention is number one. I want to be able to, if I have grandkids, to be able to toss a ball to play with them. I want to be independent. I think what a lot of people don't see, and something that I have had some experience with when it comes to general health and aging, is that there is a huge drop-off in independence and quality of life that is very dependent on how well you take care of yourself. Because of the fact that I've been in cardiac and pulmonary rehab, I've seen the end of the spectrum where people can't stand to take showers. Tying shoes, getting out of bed in the morning, all these things are very difficult. And granted, these are the pulmonary patients who have COPD and advanced stage lung diseases. So that's kind of the end of the spectrum. But I also see my own grandmother, who's very independent, who does most of her own yard work still. She's in her 80s. My great-grandmother lived on her own, by herself, for the most part, until 100 years of age. And that's what I want for myself. I want to be independent. I want to be happy. And that's the kind of life I want. When I look at my gym goals, my fitness goals, the things that I want to do with that, there's always that in the back of my mind. Anytime there's a tweak, there's a pull, that something feels funky, I'm very aware to back off. One of the big reasons I think a lot of people don't really prioritize injury prevention as a main priority also is that they're too worried about progressing. However, as soon as you have an injury and you can't train, you're now regressing. You now have to go backwards. I would much rather take the time to go forwards and continually be moving forward than to make bigger steps forward and then have to take steps backwards and then regain that ground that I had made up or that I had made in the past. I really, really want you to think about injury prevention and prioritizing it in your regimens and with how you look at lifting, not only because of the fact that it is going to help you be a better lifter in the short term. If you can prevent injuries, you can be in the gym more, you can accumulate more volume, you can become stronger. But I also want you to think about injury prevention in the long term, for when you're 40, when you're 50, when you're 60 years old, how those prior injuries are going to affect you in simple things like getting up out of bed, walking distances that you might need to walk, going to the mall, going on outings, just these simple things that we don't tend to pay attention to because when it's easy, we take them for granted. Guys, that's really all I got today. I hope that it sort of opens your eyes to a little bit of things that maybe you weren't thinking about. If you've already been thinking about it, I hope that it reestablishes your reasoning for looking at injury prevention and keeping that a priority. Anyways, guys, I hope you have a great week. Happy lifting, safe lifting. See ya.